Hey, good afternoon. My name is Matt Sickles with Sirius Computer Solutions. This afternoon, we wanted to take some time after you've had an option to listen to a couple other sessions to dig into something that is omnipresent. Someone's always concerned about it right now. That is ransomware. And as we take a look at how ransomware is affecting the organizations of healthcare and other industry, we want to make sure that we are digging right in. We're sharing with you some of the currency, some of the models of solution sets, and then also the currency of risk that this applies to your world. With me today, we have our partner from Rubrik, Zak. I'll let Zak introduce himself, and then we can jump right into a conversation.
Thanks, Matt. My name is Zak Pellecchia, so I'm a senior sales engineer out of Rubrik. And for the last 10 or 12 years, I've been a data protection and disaster recovery specialist. Also got a focus on VDI. I was involved in the team that virtualized some of the EHRs, moved them off a physical server, and also had some experience with, I was one of the first partners to deploy McAfee Move in an environment. So hoping to have some great conversation with Matt today. I know he brings a lot of experience in the security space. So.
Excellent, excellent. Yeah, and Zak, as we've gotten to know each other over the last couple of days, it's interesting because as you are focused on a lot of the hardware solutions, we are focused a lot on service and hardware solutions. There's a great overlap. And as we're getting out into the communities, we're starting to have the conversation of what is the real risk? What is ransomware doing to organizations? Is that something you're finding as well, that you're being asked to provide some of those ancillary tales, some of that experience out in the field?
Absolutely. Yeah, I think too, like anybody you ask, there's a lot of organizations that are afraid to kind of admit they don't really have a great strategy. And then there's other teams that are just like, I don't have a strategy. And some think they have a strategy and don't realize that, it's missing a lot of things. And that's where I think both Sirius and Rubrik can do a great job to help build a plan for them. Right? Matt, anything to add?
Yeah, and you know what? We wish it was cookie cutter. We wish it was something that we could repeat every time and get the same results. Unfortunately, we're not there yet. We're still learning a lot. And so in the last 6 months, this frenetic pace we're seeing of attack after attack, impact after impact, we have major hospital systems across the nation right now still running off of paper because they can't elevate their EMR and EHR systems to full operation. Their PACS systems are not back online. And as we have also seen some guidance from Department of Homeland Security and Health and Human Services, that is something that is now being warned about, the currency of risk in our PACS systems, the imaging systems, and how that might affect. So as we play into that, there's always a combination of the predictive data protection. Zak, in your career, I'm sure that you've run into the organization that has the fortress around their data, and then they integrate with a third party. And that third party opens up this ultimate risk, some type of a vector that allows information to come and go as it pleases, but that may not always be secure. Is that something that, is commonplace, or is that the exception?
Yeah, I mean, we're seeing it quite often. We've seen customers. If you think of the SolarWinds attacks, right? You had a situation where attackers were on customer networks for months at a time, right? And this is where, I think there's a lot of misconception about what a ransomware attack looks like. I think, when people think of that, they think of the early days when it was a script and it got on your network and you click the script and it would start running and go infect files, right?
Right.
But now they're doing tons of recon, right? You can think of what they're able to do it with months to prepare, right? You see them doing things as far as using tools like PowerShell to run regexes. And if you're not familiar with the regex, it's basically finding patterns in data, right? So I can search for social security numbers, addresses, names, things like that inside your data. And when I start my attack and start encrypting data, I can actually target those files as well as backup data, right? So it's getting super complex with what they're able to pull off in these scenarios. Even saw a customer recently had their somebody log into their storage array, right? And really go after the storage footprint and leave them with kind of just a complete outage, right?
Yeah, and I'm seeing, yeah. So that exact scenario, it's interesting. We had that at a healthcare. It was that was mid-February, and sure enough, we found out they had been in for months before they actually launched the attack, and they went after the storage array. So you've seen that as well.
Yeah, absolutely. And it's funny too, like the more we talk to executives at different organizations, especially in the healthcare space, we find that they've had challenges with getting the security teams and the infrastructure teams to talk, right? Security teams say, hey, storage
Mhm.
array, that's your problem, right? And they don't think about, hey, how can we better secure those storage arrays? Like, do we have things like MFA? Do we have other ways of locking down the systems to prevent attackers from being able to possibly get into those systems? But because the teams are so separated and often don't like talking to each
Right.
other, they don't really connect on what those things look like.
Yeah, it's funny too because as we have taken a look and dissected the last several major breaches, there's been a couple of that have been public. They've shared a lot of good information, but we don't know the reality of what really went wrong. We can surmise out of a lot of the ancillary data. We can pull from that. But I will tell you that you've hit on the storage, you've hit on the controller, and now we're talking about the network and the directory service. So Active Directory comes into play as well. And everybody who is listening to this understands that you really can't gain access into your environment without a functioning Active Directory. A directory service is one of the key and core services. So I'm sure that Zach, you've seen this a lot, where that in these attack scenarios and in these use cases where we go back and look, the directory services potentially are at risk as well, and that has been made vulnerable.
Yeah, almost every time, right? If you can steal LDAP accounts or even like password vault hacks, right? You're now able to gain access to systems and gain access to files, right? Like again, going back to 10 years ago when ransomware was a script, whoever kicked off the script, it was those permissions. So whatever that user had access to, that's all you could gain access to. Now, again, with months at a time, I can go scan your data. I can try different accounts to log into different systems. I can spend months just doing recon and figuring out exactly how to pull off attacks. And to your point earlier too about, nobody's really disclosing this information and what attacks look like. It becomes a lot harder
Yeah.
to prevent it when everybody's afraid to talk about it, right?
Yeah, agree. And, I wanted to hone in on something. So, as we're talking and focused on healthcare right now, we know that the expense for staffing and for running a lot of the security has fallen by the wayside over the years. It's a costly investment. If we think about it, it really shouldn't be called a return on investment for security. It really should be a return on expense, right? We know that we have a calculus of what the base cost is to protect the systems. And then there's going to be years where it's going to be elevated because of the currency of risk. And then we are going to have these trust models that we have to try and define and protect against. This is anytime there is a new type of a threat, et cetera. So are you seeing healthcare individuals and groups that you're out talking to now, are they getting that message that, yes, it is going to cost more. It is going to take a little bit longer time to mature your program, but they do understand that without that additional investment and expense on top of that, it's not going to come to fruition for a new protection model.
It's really funny you say that. I saw a meme on a security website recently. It said $500,000 for a backup solution that does, XYZ. No, we're all set. That's too expensive. And then 3 weeks later, they get hit with a $10 million ransom demand, right? And so it's like, what is cheaper in the long run, right? Having things protect you, having those extra layers of security, or the actual attack itself, or the cost of downtime, right? Like you're talking about hospitals. How much impact is it to have to reschedule elective surgeries? Things like that, having the ER emergency rooms go down because, you can't keep up with the pace. I've definitely seen that quite a few times in my career. So.
Yeah, we have some real experience recently on that with a healthcare provider on the West Coast here in the U.S. As we've been working with them in their recovery state, and we're looking at a lot of the things that did not go right. They didn't technically go wrong, they just didn't go right, or they weren't in place. You're right. It is that backup. It's having that air gap, and it's having that protected state view of your systems so that you can come back online. Epic and other EMR, EHR systems, as they are offline, there are actually reports you can run out of those systems to find out what the revenue per minute is. This is something that a member of our team here at Sirius Healthcare, Marty Momdjian, has done as he has gone into a lot of these organizations. He's running reports against the business core system to make sure there's a reality check. As we look at those ransomware elements, we understand exactly how it could hit the revenue model, patient care, continuity of care. All of those things come into play. Of course, the healthcare is first, and the patient becomes the omnipresent issue. You have to take care of the patient, but there are so many other elements of that that we want to stay, in a safe mode and in a more controlled mode.
Hey, you hit the nail on the head, right? If you want to talk about risk, like money is one thing, but the lives of patients is a whole nother level, right? Like you really can't put a dollar amount on that. So it's a great call out. As we talk about Epic systems too, I'd also, be remiss not to talk about Sirius's testing with our Epic protection and the stuff we've been doing with Josh Peacock. I know you know him at Sirius, right. Travis Rabita. And they've been hugely impressed with how fast we can back up Epic. We've gotten a few customers from 36 hours to do an Epic backup down to like 12 or 14. And we're seeing customers that, usually couldn't do a backup in 2 days are now doing it twice a day, right? And what that brings them is in the event of a ransomware attack, you're looking at less data loss risk, right? You have more points to recover to, things of that nature. So, it's been great working with your teams in general.
Yeah, and likewise, we have a lot of people who have worked with us in the past who are now with your team, and it's great to work across the aisle. I think you're referring to some of the learning lab that we have out on the West Coast. We work in concert to make sure that we actually have a healthcare lab, and we run through those tests. As you mentioned, Josh is very focused on the healthcare systems. As I mentioned, Marty is very focused on a lot of the what's coming down, what do we need to be prepared for. Those are all elements of a core program. It's not only just having that self-actualization inside of your own organization. Do I have the capability of handling this on a standard business work week? But if we transpose that into an incident response, and now we're starting to look at, okay, how do I handle that? That's one of the things that I would recommend to any healthcare organization right now, is to focus on the incident response planning, because as we have been working with each of the healthcares in a remediation state, we look for a lot of those key and common threads. And one of those common threads is that they are resource constrained. When the attack occurs, we're jumping in and we're helping as much as we can, but sometimes there's so many people you can throw at the problem. But, Zach, earlier you were mentioning about that people, process, and technology triad. So we actually have to have the technology that supports a solid base of people and a solid base of process and technology. So we get that people, process, technology that aligns together. But without a good process in place, without those policies, the technology really becomes mute. It is not able to do its work in total. So as you're looking to protect data, as you're taking some of your solutions in healthcare specific, if we wanted to zero in what is the most common threat that they're seeing from a data protection model that is ignoring that people, process, and technology?
Yeah, I'd actually say, part of the biggest risk is that you have to rely on people, right? Even though you have process, even though you have people, even though it's clearly defined, we actually just did a case study. There's a YouTube video from Estee Lauder, not a healthcare organization, but their quote was, "Hey, we had really stringent security policies in place about what they should do with sensitive data, where they should put it, and we thought everyone was following them. And then we got Rubrik in place, did some data discovery, and found data in areas that we didn't expect, right? And this is from a company that thought they had a great security posture, and just were like, I was amazed by how much I didn't know about what was out there. So what we bring to the table that I think is really helpful is this idea of auto protect. And what we'll do is auto protect any new workloads that you add. We have very unique ways we do that. And then by doing that, you can also layer on top anomaly detection and data classification, data discovery, those sorts of things, to give you kind of a holistic view of your entire environment, from a data security posture to a ransomware anomaly posture. And then obviously, when all else fails, you have those backups to revert to. And I think that's what's really resonating with customers.
Yeah, and the backups have been a big target too. So you've heard us harp on that backup scenario, but I have not been involved with one breach response team this year that didn't contain some deficiency in the backup, whether it was an air gap methodology, offsite rotation. Ironically, one of the clients that was attacked still was on tape. They were still rotating out. So they did not have the bigger effect of having everything on a storage array. So as we look at those protective technologies, you brought up a really good point. That data isolation, the data protection model is only as good as the intelligence and the visibility. We look at visibility and telemetry as one of the key components of security. If you don't have that tenant in place to make sure that you understand where data should be, where it's moving, and most importantly, how it can be affected once one of the machines becomes vulnerable in your environment, that's where real risk comes in. And let me just give you a quick example of that I've seen, and let's see if that is, something that you're seeing as well, Zach. We get these machines that then become the command and control zombie on the network. They are affected by the malware. The payload is dropped on those, and guess what happens? That machine, then anyone who's ever logged into that machine, you can get the trail of credentials, that you can actually take a look at a lot of the information that is used against you just by the ease of single sign-on. So without multi-factor in place, these machines became the lateral drones and they started spreading the malware side by side. Is that what you're seeing as well?
Yeah, in some cases, and like you said, there's other risks too. Like I've seen organizations who got hit with malware and they didn't notice, right?
That's right.
Maybe their employees didn't catch it right away. They didn't have the tools in place to identify it, right? And what they ended up doing was backing up that bad data for days at a time, sometimes weeks at a time, right? And so now when you're recovering the data, you're actually recovering encrypted data, right? And this is where kind of Rubrik really helps with that anomaly detection. If you know exactly when the ransomware starts, you're in a good position, right?
Right.
You won't know about payloads, but if we're being honest, Matt, like finding a payload is next to impossible, right? So we're not detecting on that. We're not dating on known signatures because known signatures have to be known, right? I mean, that's the whole problem with security. You kind of have to find new vectors and find these attacks and then create ways to stop them. So what Rubrik does is it just looks at what are the patterns that happens to the data, right? And so it's basically what we call security at the point of data. So you're seeing the patterns that happen within the data and you're saying, okay, that is indicative of ransomware attack. These files are encrypted, these files are changing more sporadically than usual, right? All these different things that we can look for. And that's where we kind of can give really good data security policies. Is that
yeah, it does. And so I'm just going to go on, there is going to be deficient and legacy systems in all industry, not just healthcare, but all industry. They can't be patched, can't be updated. They're just on the network. Those sometimes have a higher risk than something that was patched a year or two ago, but something that is running at a manufacturer state or an embedded system that's 15, 20 years old. That's what is being used against us right now, is our waivers and exceptions to good policy. So as you're talking about some of those machines that can become infected, we really don't worry about the one machine being infected, right? That's what endpoint detection response is for, a holistic security program that has that incident response planning, business continuity, disaster recovery, threat vulnerability management. All of that gets sandwiched together, right? And the threat and vulnerability management is exactly what we're talking about. We have to assign a risk level now, not only to the machines, but the people accessing them and the data that they're accessing as well. So now it becomes that, all right, we have been corrupted for months. We need to go back into a known good point in time. these machines that are on the low priority list, we're never going to get them back, because if they were corrupted, they just need to be replaced or they need to be wiped and restored. But you're talking about that predictive backup, starting to guess the anomalies and looking at some of that security orchestration and automation that we want to layer in. So from a ransomware perspective, when organizations ask me right now, what can I do to protect against ransomware? And literally, it is go back to those basics, right? Know if you have a problem, have a detective mode that can actually be sitting on your network and start to ring alarm bells, whether that's your security event management, whether that is your security or network operations center. But Zach, that backup, going back to those multi snapshots and those images, that's really one of the only ways, once you find the timeline of a ransomware or a malware event, to put Humpty back together again, right?
Exactly. And you brought up some other interesting stuff so we're currently, working with Palo Alto, another partner we have out there, right? And one of the things that we've actually started to do is feed our data about what we're seeing for user activity and things like that, and saying, hey, if we see a user that's going around and making anomalous changes, why don't we have Palo Alto go disable that user in Active Directory, right? So now you're getting to the point where you're proactively disabling accounts that have been compromised, right, to get you a level further. And it all comes from that being able to have data discovery or get more data from your data, right? And the biggest challenge that I see with that is most of the tools that are used run against production systems, right? And a lot of times they require an agent. A lot of times, like if you've ever had your backup antivirus scan run in the middle of the day, right? And you have your laptop and all of a sudden everything goes really slow. That's the same thing that happens when you're scanning billions of files on a share somewhere, right? Trying to find data. So by taking that on the backup storage and doing it against backup data, it prevents the impact for production. And because the backup platform has all of the data in your environment, because you're backing up everything, I now have a view of everything in my environment, right? And it's got that kind of holistic view, right? It's getting you everything, and it's able to give you some of that telemetry data to make kind of moves off of, right?
Yeah, and now you start to look at those behavioral changes. So you're really talking about that behavioral analysis, right? We're not just doing it at the point in time, inception of creation, access, or modification of a file. There are some things that are going on. That's going to tell you about the health of the organization as a whole, right? We're going to start seeing some of those ticker tapes line up, and we're going to get the bells and whistles that say, hey, we've got a problem here. We need to start to focus on this clinic. We need to focus in this area within the pathology lab. That's really starting the trending. So you're talking about the identity management, the resource management. And as we really start to get advanced of how do you get to that state of having no trust in any device that's on the network? If we take a look at the Internet of Medical Things and doing a really great inventory, by the time you have that basis of inventory, you need to have technology that is scraping that on a routine basis. So if we take that parallel between the medical technology IoT or IoMT, we parody that with some of the stuff you're working on, that all feeds into that overarching threat intelligence model. So now this is probably a great byproduct of all of the spend and all of the focus on security, and not only healthcare, but in industry, is the threat intelligence model has greater sampling. It's going to have a much better response plan, and we're going to start to get those indicators of compromise in the wild quicker. And think about how you can orchestrate that with technology.
Yeah. Actually, speaking of orchestration, we just released another product that essentially helps take that anomaly detection, find that point in time, identify the systems, and then chart out what time the anomalous activity started.
Wow.
So now I know what my restore point is, right? What my last known good configuration is, and fail it over. And not only that, we talked about this earlier, Matt, if you deploy in an infected environment, you're going to get reinfected, right? That whole one workstation can be the catalyst for deploying ransomware across your environment, or spreading a payload, something like that, right? So why not restore into an isolated network, right? and use that as a form to, hey, let me recover this data. Let me see if the ransomware attack continues. If not, let me swing it over back to production, right? So I can isolate and make sure that nothing's been affected.
Right. Yeah, it's interesting. I was just thinking back to one of the attacks, and I was looking, for some corollary there, so I could be a little bit more gentle about this, but I can't. So here's what it is. You hit it on the nail. It is when you have a ransomware event, when you have an attack of magnitude in the organization, you have to go to a no trust, zero trust environment right away. You have to start quarantining and segmenting bad behavior machines, bad actors, and unknown actors all throughout your environment. So that is the time where a lot of those decisions are made. And think about how that you can do a little fast tracking and getting ready for that just from a programmatic perspective. As security maturity goes up in your organization, as you start to have more control over the information, why not go ahead and make sure that you've got elevated permission control? So multi-factor authentication, privileged access management, and service management, all of those things that help prevent ransomware and malware events. That's really what we're getting to. And I love the orchestration, but rule number one of computing, if you want to do it, you probably can. Rule number two, you have to go in with an open mind that you have to demonstrate it manually before you do it programmatically. So that programmatic approach and that repeatability, is that something that can just be learned by machine learning at the same time? So I think that that's really what we're getting to, right? Is advanced intelligence, machine learning code now on top of some of these solves and solution sets. That's where we're going to get some of the greatest efficiency of, okay, I'm resource constrained. So what do I do about it? I start to take a look at how technology can be my robot, my advantage.
Yeah, I mean, you again hit it on the head. Like one of the biggest problems I see when I talking to customers of all types is if you ask them, what's your recovery time objective? How long can you be down? Right?
Yeah.
And they'll be like, oh, I know that. And then you say, okay, how long does it take you to recover? And they say, I don't know, I've never done it. Right. And you go, okay, let's do a dry run. And, their RTOs are like a couple hours, and the actuality is you're talking days. Right. And this is where like we've actually showed Rubrik's value because we concentrate on restore over backup really. Right. We back up really well, but restore is kind of where we absolutely shine. And then the other
real quick, I want to just plug in everyone listening to this. If you have not done a tabletop exercise that is being discussed right now, if we are not, is this something that you've done? If not, you better get it started, because this is one of the keys, right? Is that tabletop and actually practicing.
And I would say the one other thing that you really pointed out is if you're going to test restore and have to restore data, like a lot of challenges that customers have is, hey, I have to restore my whole VM. I have to restore massive amounts of data. I don't have enough production storage to do that, right? I can't have 2 copies everywhere. So it's either I got to chop off my whole arm and lose, days or months or weeks of data, right? And to get back to a good state, and I can't recover any good stuff. And the other problem with that is the FBI is getting involved in these negotiations, and they're trying to get forensic data from the ransomware attack. So if I delete it, I know I've lost all of my, it's like deleting fingerprints, right? I now have no idea how they got in. I have no idea how to prevent them in the future. And I'm still in the same situation to get attacked again in a few weeks, right? Or a few months or something. So, that's where Rubrik really shines again with, we can not only tell you what files were affected, but we'll give you a nice UI. You can just select your affected files, restore the good ones, and keep the bad ones so that you can give them to your security teams. You can give them to the FBI, and they can use that forensic data to help secure you again in the future.
Yeah, and I want to stress one of the things that you're hitting on real quick, and that is the chain of custody. For those of you who have not been through an event, for those of you who have just sat on the sidelines while maybe a peer of yours in the region has been through an event, there is a point in time where the different agencies come in, your incident response insurance carrier comes in, and you sometimes lose control. You don't get to make decisions anymore. So the better you're prepared to have these tabletop exercises, have all of this information in one good repository, Also, remember, make sure that you print out the binder. Don't leave it on SharePoint. You may not be able to get there. So these are all real key elements of getting ready for an event, the ransomware awareness, the preparedness, and you should not be reacting, you should be responding. So it should be your ransomware response plan that is contained within an incident response plan. And
Yeah.
that's one of the key elements.
And just, one other thing is, when these organizations get involved, a lot of times it triggers audits, like HIPAA audits, PII audits, right? So not only are you getting hit with a ransomware demand that you may or may not pay, you may get hit also with the double ransomware, or the double attack, where they actually say, hey, we're going to leak your data now because we stole it while we were encrypting it. And so we're going to leak it as well. So you get the double hit from a ransomware perspective.
That's right.
And the FBI says, oh, by the way, you had HIPAA hits that you didn't know about. We're going to fine you. And you paid a terrorist organization. We're going to fine you again. People don't think of all these different fines. And, again, going back to, I have a hospital that thought they had a great security posture. They said all of our sensitive data is on these couple servers, and we have multiple products that we use to go find all this HIPAA data, PII data. They did a Rubrik POC, and we basically deployed it, and they said, hey, you can pick these couple random servers over here. We found a HIPAA export that had 100,000 patient records that was on a dev machine that somebody had exported, probably to play with some production data, just from a dev exercise perspective. They had no idea it was there. And they absolutely went into full on panic and were like, that can't be there. We need to get rid of that, right? So again, that data posture problem, right? And being able to, one, identify that stuff before the ransomware attack happens, be able to identify, was patient data hit? And say that before I have to disclose it to the press or the FBI gets involved. It makes you look a whole lot better as an organization, right? To be able to say, hey, we knew about this, we knew it was hit, what wasn't hit. It's really helpful to the brand of the business, right?
Exactly. And, as we come to the close of, just our discussion time, there's a lot of salient topics that we've covered. We want to make sure that, we share a lot of our experience. So as Zach and I have gone through and we have, mentioned a lot of the healthcares, notice that as we talk about them, they are all different. And all of these use cases are different. This is real world experience. As our partnership between Sirius and Rubrik has been there for years, we grow that with these events. We start to see a lot of those capabilities. And, as you are going back into your environment after you finish the conference, that's one of the great things to take a look and have a little bit of an introspective on where are you heading with your program? What are some of the things I need help with? And most importantly, how can I get that assistance? We've covered a lot of topic today. We've talked about ransomware down to the effective network control plane. We take a look at zero trust, identity management, and whether you realize it or not, all of those topics can last hours just to get up to speed on what is the currency of risk, what is the challenge in the environment. So as we started our conversation today, it's easy to finish it. We would love to have that follow-on opportunity always. But as you walk out of these conferences, make sure that you create your own bird of feather session with your peers. Have a conversation about what you heard. Make sure that if we're sharing something with you that caught you off guard, you make sure you share that with some of your peers who may be caught off guard as well. And that way, it doesn't just become a technology threat intelligence hub, it becomes a people threat intelligence. We start to share that information and it becomes part of the collective. And with that, I'll let Zach close.
Yeah, I think you nailed it, right? People, policy, and product. The most key things is security posture. And then just re-education. Like, doing it once is never enough. Do the tabletop exercises, run through it a few times. It's all in the realm of what's possible in the security space, right? It's never about what you've seen. So with that, I just want to say thank you all for your time. Thank you, Sirius. And don't back up, go forward.
Absolutely. And on behalf of HealthIMPACT, thank you so much for taking the time to listen to us today. If you have any follow-up questions, please use the feedback form and we'll be glad to get you further information. With that, I'm Matt Sickles with Sirius. Have a great day.